everybody. We are just going to have a look today at how we can use a simple tennis ball to release off and hopefully reduce any painful areas you might have in your buttocks and pelvis and down the leg. Okay, so tennis ball to start with, and we're just going to start firstly releasing the muscles and the fascia off through our gluteal area. So I'm going to place the tennis ball between the knobbly bit of the top of my pelvis and the knobbly bit of my hips. We don't want to go on those knobbly bits, it's on the soft squishy bits. Okay, so placing it there, and then I'm just going to roll over onto my side, and we can just roll forwards and backwards or up and down through that small area. And the idea is you're going to find a little tender spot. There may be more than one. Okay, so if you have a little rummage around in that area, it might mean rocking backwards a little bit more. Once you've found your ooch spot, we're just going to sit and hold it there. So you can imagine the ball is sinking into that tissue. It might have already done so. Okay, no, mine's disappeared there, but we're just going to hold that air in that position. Now the idea is that the pain might not subside completely, but you should, after 30 seconds to a minute or so, start to feel it subside a little bit. Okay, now sometimes these areas can also refer pain down the leg, and the idea would be that you would hold it here until that referral of pain started to reduce. Okay, so moving swiftly on down the leg, we're next going to look at the side of the thigh. So our fascia is connective tissue that joins all the muscles and everything together, and we've got a thick band of it down the side of our thigh, also known as our iliotibial band, or IT band for short. So we're going to have a go at releasing off down that area. So we're going to start with the ball just above our knee. So straighten out that lower leg, and then we're going to roll on that ball. So from above the knee, right up around the hip. Now you need to reposition it. Okay, now again, we're not moving or rolling over the joints. We're aiming to work into the soft and squishy parts. And again, you might want to continue working or rolling up that full length, or you may find a spot where you just want to hold it there. Okay. So really common if you have knee pain, a lot of people, this area can also be tight, and it can be surprising once if you release this area off, how it can help those knee movements or knee biomechanics. Okay, hold it there and release that off. Moving down further to our calf. So we are just going to start with the ball above the heel, so not too low down, and then again we're just going to roll up and down. Now our calf muscle has two heads that attach to the inside and the outside of the knee, so to target those areas we'll just turn our toes outwards to begin with, and you should feel that more down the outside of your calf. Again, you might find those little spots we call trigger points. Just hold it there if you need to, and then turn your toes inwards and continue to roll up and down. You'll find that inside head of the calf muscle, and we'll release that off there. And lastly but not least, we're going to use the ball underneath our foot. Okay, so we are going to roll from underneath our heel right to the tip of the toes. You can put quite a bit of pressure through with this. Now this is called our plantar fascia, which is a thick band of tissue or fascia that is underneath our foot and can be the cause of a lot of foot pain. But often this is not just tight in isolation, you'll find that you need to release off through the calf as well. Okay, so really working through it again, work through the inside and then to the outside of the foot, and it should start to release off. You can also do this particular one in standing as well if you feel you need a little bit more pressure. Okay, release that off, and that's our whistle stop tour of how to use the tennis ball to release the muscles and the fascia of the lower leg. Thank you everybody.